Hello everyone, today we are going to discuss the determination of acute eye irritation or corrosion of a test substance by Professor Sabashik. So first we'll see the aim of the experiment. So the aim of the experiment is to determine the acute eye irritation or corrosion of the test substance. Now we'll see the principle. So the substance to be tested is applied in a single dose on one of the eye of the experimental animal, and there should be the pre-treatment with a systemic analgesic and the induction of appropriate topical anesthesia. These two steps is very much important in order to reduce the distress to the animal. So that means before applying the drug to be tested into the eye of the animal, first we will give the animal pre-treatment with a systemic analgesic and induction of topical anesthesia. The untreated eye serve as a control. The extent of eye irritation or corrosion is evaluated by scoring lesions of the conjunctiva, cornea and iris at a specific time intervals. The duration of the study should be sufficient to evaluate the reversibility or the irreversibility of the effects. Animal showing the sign of distress or a severe pain at any stage of the practical, then in such case what we'll do, we will humanely kill the animal and the substance is then assessed accordingly. Now we'll see the requirement. So obviously we required animal here, so we are taking here as a albino rat. Then dose in case of the liquid, the approximately 0.1 ml of the test substance should be given, and whenever there is the formulation is in solid or semi solid form, then 100 mg per of the test substance should be given. Now we'll see the procedure. So buprenorphine is nothing but is the we can say the analgesic 0.01 mg per kg to be administered by subcutaneous injection 60 minutes prior to the test substance to provide a therapeutic level of systemic analgesia. Then 1 or 2 drop of topical ocular anesthesia, for example 0.5% tetracaine hydrochloride, to be applied to each of the eye 5 minutes before the administration of the test substance. Then after applying the anesthesia, what we will do, the test substance to be placed within the conjunctival sac of the one of the eye of the animal. The lid are then gently held together for about 1 second in order to prevent the loss of material. The other untreated eye will be served as a control. Then the observation should be performed and recorded at a minimum 1 hour, 2 hours, 48 hours, then 72 hours, 7 days, 14 days, 21 days in order to determine the status of the lesions and their reversibility or irreversibility. The grade of the ocular lesion should be recorded at each examination. So how we will record the lesion? So basically the reaction to be examined by using the hand slit lamp, biomicroscope or any suitable device. So what is the status of the eye after applying the we can say the test substance? We will check by using all these instrument. Now as I told you just now that we need to check what all the different changes that occur after the application of test substance. Then what we'll do, we will give the grading according to the observation we got. Like in case of the cornea, if no ulceration or opacity is there, then we will give the grade as 0. Then detail of the iris is clearly visible, then we will grade as 1. Detail of the iris is slightly obscured, that is unable to it is not clearly visible, then we will give as 2. No detail of iris visible, the size of pupil barely discernible, then in such case we will give the grading as 3. Then opaque cornea, iris is not discernible through the opacity, then in such case we will give grading as 4. That means in the last we can say the last grading, basically here the cornea is not at all visible. Then iris, if the iris is normal, we'll give the grading as 0. If there is a congestion, swelling or iris reactive to the light, then we will give 1. If there is a hemorrhage, gross destruction or no reaction to the light is there, then we will give here grading as 2. Then conjunctiva. So what are the things that occur to the conjunctiva when we apply the test substance? So accordingly we will give the grading 0, 1, 2 and 3. 0 for normal, 1 is some blood vessels are basically red in color, then we will give 1. Then diffuse or crimson color, individual vessel not easily discernible, then in such case we will give as 2. And if the eye is totally red, then we will give here the grading as 3. Then chemosis. So if there is no chemosis, normal is there, then we give 0. Some swelling above the normal is there, then we will give 1. Obvious swelling with a partial eversion of the lids, then we will give 2. Then swelling with a lid about half closed. So when there is a swelling and the eyelid of the animal is the half closed, then we will give 3. And when there is a swelling with the lids more than half closed, then we will give here as 4. So now we'll see the observation table. So this is the number of animals. So we have taken the 6 animal, and now we will check the we will give the grading to the ocular lesion. So you can clearly see here, in case of the cornea, the reading came here are like 2, 3, 2, 3, 3, 2. Then we'll calculate the mean of it. So it will come here as 2.5. That means there is a moderate to severe corneal irritation is there. Then in case of the iris, it is 1, 2, 1, 2, 2, 1. Then the mean value is 1.5. That means there is a slight to moderate eye irritation is there. Then in case of the conjunctiva, we give the grading like 3, 2, 1, 3, 2, 2. The mean value is 2.1. That means there is a severe conjunctival irritation is there. And about the chemosis, it is 2, 1, 1, 2, 2, 3. Then it come here as 1.8. So that means the chemosis of the test substance was found to be moderately inflammatory effect. So basically what we have done here, based on the grading, we can comment on the result that it is severe corneal irritation, slight to moderate iris irritation, severe conjunctival irritation, and chemosis is there, which is moderately inflammatory effect. So this is all about the experiment. Thank you.